So this session is called Infant Nutrition and Complementary Feeds. Nourish early, flourish forever. It would be chaired by Kashinachi, and we'll be having Dr. Malati. Ma'am, may I invite you onto the dais, please. And Ms. Padmavati, please welcome onto the dais. Randy, please. Did you open and keep it? Okay, okay. It is open, no? I'll keep it. Okay. Yes. Also, సంతోష్ జీ ఉంటారా ఈ సెషన్లో? ఈ సెషన్లో మీరు yes. Also, thank you, dear audience, for being patient with us through our processes. I understand sometimes it can be a bit this thing. And I know today is World Food Day. I will not stand between you and your food for too long. But let us go into this session, and after this we will be breaking for lunch. Request you to please give us a couple of minutes while we set up the slides.
On this we have two esteemed panel members. Dr. Do you have slides about them? No. No problem. Dr. Malati Shyamala, she is currently superintendent of Vanijay Rosaya Nature Cure Hospital. It's a government hospital, very big hospital, and so she has done BNYS and then MSc Nutrition and also then PhD in Nutrition from Osmania University. So she was Vemana Yoga Research Institute Director, and she has a lot of experience in solving many health related issues using naturopathy and yoga. And she will be giving her insights on infant nutrition in the naturopathy perspective. And with us, Dr. Padmavati, yeah.
Nutritionist and public health consultant.
Padmavati Garu is a nutritionist. She is qualified in that, and she has a lot of experience in public health with UNICEF. You name any big organization which is working in public health, she is on that, and she is a specialist in public health nutrition. So they'll be sharing their perspective on this subject. So first I request Dr. Malati Shyamala Garu to speak about her take on this infant nutrition and how naturally, naturopathy means they feel that food is the medicine. So when we treat food as a medicine, how do we do that, and how the baby can grow very well with natural food, and how naturopathy practices can enhance this.
Good afternoon, and what sir is asked is how naturopathy is going to be helpful in the infant feeding and all other things. First thing I would like to say that the mother nutrition is very important. See, infant means from the 0 age to the 1 year, after 2 years also it may be called. So as just now we have last session, they have given the importance of the breast milk and how the breast milk is, what kind of nutrients are available and how it is and everything we have learned since morning. So, to get a good breast milk, breast is, everyone says there is a breast. No, actually in what I say is, B-R-E-S-T is the spelling of the breast. B stands for the breast, R stands for the resistance. Okay. B-R-E, E is economically, it is. Economically means it is very cheap and easily available. Whenever the baby gets wants to get the milk, immediately because of the neurological action, because of the latching itself, the baby gets the milk. That is economically cheap and also it is easily available. Yes is very safe. We are not doing any kind of a pasteurization, or we are not taking any, we are not bringing into the bottles, or we are not giving it as that. We are ES. T is for the taste. That's why baby always says that chaparinchan they chew because it is very tasty. So breast means the stands always things. So to get the good breast milk, the mother should feed good nutritious food. That is very important. Naturopathic way of feeding is the age-old systems of the feeding. That is how the grandmothers and the foremothers and all, what kind of food they had and what kind of the food they have prepared is very natural. Nowadays, what is happening means, in this present situation, no mother is having the time to feed her baby. That's one of the very, very bad and pathetic conditions that babies are not fed by the mother. That kind of love, that kind of affection, and that kind of things. Now what happens is that everything is a spoon feeding. Spoon, with the spoon only they will feed the baby, but not with their hand. See, when they are feeding the baby with the mother's own hand, then the activity, that kind of attachment, and also the hormonal changes between the mother and also the developing child will get activated. That is nothing but one kind of what you say, mother is God. So all the time we are having with the God how we are connected. In the same manner, the baby also get connected unknowingly, knowingly with the mother. So naturally means first thing, this is a nature. This is the nature. Naturally means how we have to do is the mother should directly feed the baby. That is only the thing. Ammane talliki biddaki aharam ivvali. Nowadays what happens is that because of the day-to-day mechanical life, no mother is having the time to do all these kind of things. A keeper is there or the babysitter is there, then the babysitter will take care about the newborn baby and all. What is happening, how much the baby is eating and what kind of food the baby is giving and what kind of right food she needs, the mother doesn't know. So, till the 6th month, 6 to 8 months, at least 1 year, the baby should fed by the mother only. Okay. Apart from the breast milk, even the weaning and everything has to be prepared by the mother and to be fed naturally. What kind of food, what the sir asked is, it is easily available food. That is what we do. First 3 months and 4 months we do with the breast milk only, and if the breast milk is not sufficient, of course the formula milk is there. That formula milk, apart from now we are having a very good thing, the mother milk bank is there, so we can get from the mother milk and we can do that kind of thing. But when we come to the weaning part, what kind of food naturally we do is the rice. Because apart from the rice, nothing can do. Because what happens is, yesterday sir was also asking about me. In 75 years of the independence, we lost the millet diet. Now, it's presently from 10 to 5 years, maybe 10 years or 8 years or 5 years. From that time onwards, everybody they are getting know about what is the importance of the millets consuming. In that before you don't know what is a millet. Nobody knows. Anybody knows? Millet అంటే ఎవరికైనా తెలుసా? Before 8 months, before 8 years, ఎవరికైనా తెలుసా? ఎవరికి తెలియదు. కాదర్వాణి వచ్చిన తర్వాత మిల్లెట్ అంటే ఏంటో తెలిసింది అందరికి. అవునా? The Dhaatri has introduced the millets. Otherwise, nobody knows about the millets. But the thing is, ఏమైపోతుంది ఇక్కడ, suddenly everybody says that millet diet is very important. Start feeding the infant with the millet diet, but it is wrong. It is wrong. We are supposed to not to immediately give the millet diet to the infant because the genetical variation has come out. Because 75 years we have not taken any millets. The generated mothers, how many generations? Maybe 7 generations or maybe the 8 generations mothers, they are not fed, they are not had the food of the millets. Suddenly you are giving the birth, you are giving, the same mother is giving the birth, and we are making the infant to eat this kind of a millet diet, means the baby cannot digest. Because the changes what happened in the mother, the same kind of changes, same kind of attitude, same kind of gut properties and everything will also be transferred to the baby also. So that everything will know. So I recommend that we have to start with the rice only. Slowly we have to start with the rice, and then after weaning, after 6 months onwards, we have to slowly introduce to the millet diet. That which is prepared especially in the house only. Household preparations are very, very important. Not the outside foods are not to be prepared, preserved, processed, everything is not. Always remember that if anything is, any label, anything is expiry date is there, means it is under preservatives. Only expiry date లేనటువంటిది ఏంటి అంటే mother milk. Which is not having the expiry date is only the mother milk. Okay, so expiry date ఉన్నటువంటిది ఏదైనా mother, it is harmful. It is having the preservatives. So we have to cut down that kind of a food to be fed with the to the infants.
So you told to restrict usage of millets because our digestive system has modified over a period of time.
Yes, sir.
So now we have spoken about the feed through only mouth. There are other feeds that go along with feeding, like eyes, ears, tactile. Does naturopathy look into these aspects also?
Yes, sir. As you said, sir, feeding with the eyes and feeding with the arms and foot and all. What is the feeding actually? There's one more definition, sir. Activity is nothing but some kind of feeding. We are feeding to our eyes, means we are giving some kind of activity to our eyes, and then the brain, the nervous system is connected, is getting activated. So when you are feeding through the mouth, means all the oral cavity and the gut, everything is getting activated, and it gives a stimulation to our brain so that it has to get absorbed, and also it has to get digested and swallow, gulp, and whatever it is there. So when you are vision means when you are looking into the proper thing, automatically we observe something good, something which is which gives some kind of a happiness, which gives some kind of a what you can say pleasure. That thing which gives a good information, that thing is nothing but the feeding to the eye. And also playing with the some nowadays, I think నేను చూస్తున్నాను, no baby is walking on grass, or no baby is walking on the sand, or walking on ఎక్కడ పోయినా నా బిడ్డకి దుమ్ము వస్తుంది, నా బిడ్డకి జలుబు వేస్తుంది, నా బిడ్డకి ఇంకొకటి అవుతుంది అని చెప్పి బేబీస్ ఆర్ దే ఆర్ చాలా ప్రొటెక్టివ్ ఉన్నారు. ఐ అగ్రీ విత్ దట్ ప్రొటెక్షన్. But the thing is, simultaneously, the natural immunity which has to get from those things, it is not, we are not getting that. We are not making them to get such kind of a natural immunity. In olden days, when we used to take
Sand.
the sand, when we are walking, we used to walk all these things. So when the natural immunity is not there, we are not making the baby to get. So we are suppressing the natural immunity get. We are not making the fingers to get activated. We are not making the feet to get activated. And one more thing is that when the baby is having its own food by her or his baby's hand, then that kind of a sensitive tactile sensitivity is going to get activated, even though the babies are what you can say, the immature, means they are preterm babies and they are not having the what you can say, maturity is less than in that. So muscular dystrophies or the babies are having some other neurological problems also. When you try this kind of a skill movements, they are going to develop the skill movements by this only. What we are doing only the spoon feeding. We are making something food in the bowl and we are giving the spoon and ask the baby to eat by watching the cell phone. हमारा बेटी नहीं खा रही है, उसको सेल फोन दिए तो वो अच्छा सा खा लेती है। क्या खा लेती है? उनका ब्रेन अपना ही खा लेती है। क्या किसके वास्ते खा लेती है? उसके शरीर के लिए खा लेती है। शरीर उसका हेल्थ को back means to get rid of all these things, we are not going to get anything. So we have to do by the natural methods of feeding is that is there. So when we are making the baby to have this kind of an activity, this kind of a movement, the oral connectivity, the oral activity is going to get activated and the finger mouth movement is going to get activated when you make the baby to have their own mouth. This is finger feed. What the sir asked about is finger feeding. And ask them to walk, crawl, all these things. Nowadays, we are seeing that when the baby is crawling, अच्छा है Lysol advertisement. I think you know seen about the Lysol advertisement. What they do this? अच्छा Lysol से माफ करो, आपका बेबी को अच्छा है, कोई बैक्टीरिया नहीं है, तो Lysol को यूज करो और बेबी को crawl करने के लिए दे। So when the baby is walking and crawling like this, not on the carpet, on the floor, there is some kind of an activity is there. We have to make the baby to get all these things. These are nothing but the feeding. Feeding means only, not only everything. Everybody thinks about the eating only, but when we take something eating only, there is a feeding. No, these are also the feeding kind of things we have to have.
Yeah. Now the buzzword is gut bacteria, prebiotics and probiotics.
Yes.
Or can you briefly say on that? Prebiotics and probiotics and gut bacteria, like fruits or.
Yeah. Prebiotics means everybody knows the good bacteria is available in the what kind of a food and all. Chala mandi antuntaru everybody is needed to feed that. Not only the infant, even the adults also they need the prebiotics. What is the prebiotic? The way the good bacteria is available. That is what is the prebiotic. ఏ రాసాలే రోజు ఇడ్లీ తింటే ప్రీబయాటిక్, రోజు మంచిగా తాగితే ప్రీబయాటిక్. Yeah. Yes, it's a good prebiotic. The good bacteria, fermented bacteria is nothing but the alarm fermentation. You see, many varan fermented they say it becomes the food poison. But the thing is, after preparing the duck, it should be consumed within the 48 hours. 36 to 48 hours is good. When we are preserving in the refrigerator, that is also okay. We can maintain it, we can manageable. That is nothing but the prebiotic. And the buttermilk is very important. Nowadays, most of the people, they are not they are not showing the interest to have the buttermilk. But the good buttermilk, the cow milk buttermilk is always is advisable and advisable. Even for the children also it is advisable. We can make them to have the habit of taking this. Apart from this, I recommend water drinking is also very important. If you are not making your infant or if you are not making your child to get adapted to drink the water after getting in the age of the 15 years also, the boy or the girl are not having to have the water. Water is very important apart from the normal feeding and normal fat. Water, drinking water is very important. At least we know that. But in that, this thing next we discuss about this. And what about the prebiotics? They said that the probiotics and prebiotics means the fiber which is present in the food, which is good for the bacteria, which will help out in the bacteria to grow the useful bacteria, that is called as a name prebiotic. So that is nothing but it is available in all the vegetables and especially in the apples, banana and even the milk products and also it is available. So we can give the prebiotics and probiotics also recommended for the infants.
Right. So now I'll again come back to you. I'll ask you a few questions to Padmavati here. Please highlight the public health perspective on infant feeding. So we have to look at the community, how it is faring on infant feeding. You can use that or
Yeah, very good afternoon to all of you. So infant feeding is very important in the present scenario because most of the, as Anne said, actually most of the mothers are giving only the instant itself such a kind of supplements and not supplements food they are giving. So actually, in government of India, irrespective of what they say, is actually Agarwadi workers and community health workers, ASHA workers actually are working on how to improve the nutritional sectors of the infants. So they are giving actually lot of, they are conducting lot of awareness program for the pregnant women as well as for the lactating mother. So many programs are going on under ICDS. As we all know, ICDS, Integrated Child Development Scheme. So they are actually creating awareness for exclusive breastfeeding as well as the importance of complementary feeding. So ICDS actually they are covering from 0 months to 6 years. They are looking after the children. So as you all know, the children actually, the babies are actually taken by the mother and they are getting all the supplements. Any one of you, can you explain what are the supplements, not supplement, the food has been provided in the ICDS for the lactating mother and apart from the exclusive breastfeeding, like what are the nutritional support they are getting?
Yeah, please.
Women when she becomes pregnant, there is something called as activated checkups. So Asha and the Anganwadi teachers, they keep going to the house and they have these 3 to 4 visits. And they also emphasize on how important this pregnancy period is and how many times she has to visit the hospital. So according to WHO, it is 4 as we all know. And they make sure that this woman is going to the hospital and they also take care that she is vaccinated with TB or DD and she is also fed, like she has to come to the school every day. And she is given with food that is, it is a supplementary food. Apart from what she is eating at her home, this is like an extra food. So she is being fed with rice, with dal, and she is also given with EHR, that is the eggs. So basically every day she has been given with an egg, and also with rice.
What do you think? Your answer is very good. Actually, I'm asking after 6 months of the baby, what are the supplements they are getting through ICDS?
So basically, they are being given with milk and eggs are every day. For the child as well, for the complementary, they give badam milk. So that is like a pre-mixed food. So in that, they're supposed to add water and then mix it and then give to the child. So that's what I know.
Yeah. So actually, ICDS, thank you so much. Thank you. So actually, complementary feeding is very, very important. So exclusive breastfeeding is very, very important. Next is we have to start with the complementary. From the 6 months onwards, actually, the state government, the government of India, through ICDs, they are giving the pre-mixed food. That should be actually followed by all the caregiving and mother. It's very important. You all agree, no? My point. You all agree, no? But actually, all over India, even I have seen in Tamil Nadu as well as in Karnataka, Maharashtra, only like 50 to 60% actually they are following whatever the supplements has been given to ICDS. Is it correct? So, is it correct?
No, it's not correct. So,
It's not correct. No, actually they are correct, no. Because they are getting it and it's that the beneficiaries are not getting it. I mean, beneficiaries are getting, but they are not utilizing it properly. Sometimes they are throwing it into the dustbin and giving to the cows and cattle they are feeding. I have seen actually. So that should not happen in the coming future actually. We should follow this.
your PPT is ready. So,
Okay.
so we'll be showing the PPT of Parmath here. Can you switch on the lights?
I should carry
Yeah, it's
So I have many slides, but I try to cover major points. So integrated the key nutrition services was ANC
yeah,
as well
ఇంకా
as
రెండు ఉన్నాయి, వాడు తెచ్చేవాళ్ళు రాగి ముద్ద కవర్ చేసి
you all know PHS and
తర్వాత
village health
mothers కి
and in urban area actually urban health. So they will
ఆల్మోస్ట్ కవర్ అయినాయి.
the facility level. So it's a help of Anganwadi workers through OPD section. Okay.
ఇంకోటి
So,
what kind of food mother should take for nourishing the infant? Ragi feed. By basically ragi feed also.
Medical officer, gynecologist, staff nurse,
Okay.
the counselors, everybody will be involved in these activities. So, government of India recommends at least
వాటర్ 6 months ఎక్స్క్లూజివ్ బ్రెస్ట్ ఫీడ్ వాటర్ అవసరం లేదు. తర్వాత 6 months తర్వాత ఆ పాయింట్ చెప్పలేదు మీరు.
Maybe we can move on to the next slide. So now actually, after delivery, actually the home-based newborn care is very, very important. This is also one of the public health program which is followed for the maternal health and child nutrition. So once after the delivery, actually they have norms actually visits should be conducted by the health workers or Anganwadi workers. So they need to check the newborn disease cholesterol, whether they are kept warm, mother disease benefit diet, and mother and newborn disease regular checkup, and newborn disease timely vaccination and washing. Everything will be taken care of the village health nurse or the urban health nurse or the Anganwadi workers. They will be working collaboratively. They will coordinate with each other and they will be activities. And also they used to check whether age appropriate play activities is going on. Mother will exclusively breastfeed until 6 months. Whether the complementary feeds taken at the correct time, the 6 months, and continue the breastfeeding. So everything will be monitored by them. And using mother and child protection card. We all know the mother-child card. So that actually mainly will do whether the child growth is adequate or not. So that is a growth monitoring and development activities. So this is very important, and this growth monitoring activities which is covered by Poshan Abhiyan. Poshan Abhiyan is one of the major program going on in all over India actually, which is actually introduced by our Prime Minister. Okay. And also the child register. Okay, next slide. So these are the visits for the home-based newborn care. First visit is the third day of the delivery. Third day of the delivery. Second visit is 7th day, and third will be 14th. This is actually mandatory. The government has given. And fourth visit will be 21st day, and fifth visit 28th day, sixth visit 42nd day. So this is very very important. So why it has been conducted? Because the preterm babies and low birth weight babies should be monitored appropriately so that we can prevent the neonatal mortality rate as well as the infant mortality rate we can prevent. So Poshan Abhiyan. Prime Minister Narendra Modi ji in Junjunu Rajasthan in March 2018. It targets to reduce the level of undernutrition, other related problems by ensuring the convergence of various nutrition-related schemes. It also targets stunting, undernutrition, and anemia. These are the main objective of Poshan Abhiyan. So they have a dashboard in each district. In each state, district-wise, block-wise, the dashboard which is monitored. How they are monitoring? They have the Poshan Abhiyan app. Which is actually given for all the village health nurse, urban health nurse, Anganwadi workers. They are actually using this app. Okay, so they will enter all the information, height and weight, what nutritional supplements they are taking, everything is captured in the mobile-based application. Okay, and which we can view the dashboard. Okay, anywhere we can view actually, and they have the very good data management maintained by every ICS of each state. So it will monitor and review the implementation of all such schemes and utilize existing structural arrangements, client ministries wherever available. It's a large component involves gradual scaling up of intervention supported by ongoing World Bank assisted ICDS system and strengthening the nutrition improvement project to all the districts of the country by 2020. It is actually going on actively. They are doing
time, there is shortage of time.
Yeah.
So,
Next. I will go to compliment. So once. So that's so actually, Mahila Arogya Samiti actually is going on in Northeast India as well as in North India. In southern state also they have established. So this Mahila Arogya Samiti actually it is a group of 10 to 12 local women in each urban. So this is actually the urban health program. Already the rural health program is going on. So this one is urban health program. They want to introduce this mass levels. So urban slum actually they will select like you might have heard self-help group. From the self-help group actually they will select the members, 10 to 12 members, and they will appoint one member to leader, and which is monitored by the ASHA workers or the urban health nurse actually. So next. Who all can be members? Representation from different communities of slum and vulnerable pockets. The women group members, self-help group members. So their main services actually, they have to target actually how the maternal and child nutrition is going on in the community. So they will actually, they have to monitor the pregnant women, how many pregnant women are there, whether they are receiving all the benefits from the government programs, and lactating women, mothers of children, so everything. And also now actually they have to concentrate on non-communicable diseases also, which is also introduced by government of India. So these are the main services provided by the mass Mahila Aaryajanani members. Okay. So they will be conducting meetings in Anganwadi Center, they have to do household visits also of mass member, community center, even schools and offices, local NGO offices, etc. So all the activities which is carried out in this area.
Can you please
Compliment.
Yeah.
Infant nutrition. So nutrition during postpartum period, anyway, this is very important. So actually, we have to encourage the lactating mother, is the mother, consumption of nutrient-rich diets along with the micronutrient supplementation, which includes actually after the delivery, actually they should not supposed to stop the iron, folic acid and calcium, so that we have to ensure whether we are continuing the supplements or not. Okay, so that also very important along with the well balanced and nutrition for the mother, so that the baby will get adequate breast milk actually. And so advice on self and baby care. So advice on diet and rest, avoiding intake of alcohol and tobacco, and we have to prevent the infection of mother if the mother is having any infections, and we should emphasis on exclusive breastfeeding for 6 months. Advice on improving the quantity and quality of the foods. Continue to eat with optimal nutrition. During lactation, the daily energy requirements increase by 600 kilocalories in the first 6 months, and later on it should be 520 kilocalories from 6 to 12 months. Additionally, we should give one extra meal, that is a total of 3 meals plus 3 healthy snacks like fruits, milk, nutritious laddu, some kind of alcohol preparation, whatever, and boiled and fried egg. So in addition to the regular meal, so that they will get sufficient additional micronutrient requirements as well as the macronutrient undernutrition. Okay, so that it will improve the mental and cognitive of the growing child. So I don't want to go deeper into
Yeah, probably you can share the PPT because it is an exhaustive PPT and also she has extensive experience in public health.
The next slide.
So it is her.
So this one I have given actually one table for 6 months. What are the food that you have to introduce to the babies? So 6 months you have to give the soft polished mashed vegetables, meat and fruit and mashed fruit, and then it should be given 2 times per day. And also we have to continue with the breastfeed 3 times at least a day. And frequent breastfeed is also very important. And whatever you are introducing, it should be in a small quantity, 2 to 3 teaspoons, something like that. We should not give more quantity. And 7 to 8 months, 200 kilocalories we have to target. And 9 to 11 months, 300 kilocalories per day. 12 to 24 months, 550 kilocalories. So in 9 to 11 months, we can introduce the finely chopped food and food that baby can pick up actually. So 3 meals and 1 snacks in between meals along with the breast milk. So 3/4, that is a 250 ml bottle. So this is the quantity you have to give. So this is again, can I read?
Yeah, now let us, because we have to.
That was the last slide.
Yeah, thank you. Thanks, madam. So my last question to Dr. Malati Shah garu, at least one millet can you recommend in one line? Yeah.
We can.
Yeah, please.
As just now we have seen a table prepared by
Padmavati
Garu. In the snack period, we can introduce the ragi. Ragi millet can be introduced. It can be prepared like a soup like that's very soft and semi-solid like thing. One spoon. Introduction is very important. But we have to educate the mother first. Whether it is suitable to the child or not, we have to educate. After seeing 1 to 2 days of feeling that, if any kind of a reaction, if any kind of a unusual things is not getting digested, or baby is suffering from, or the baby may get a stomach pain, or some kind of an uneasiness, or any rashes, all these things we have to make the understand by the mother first. Then we can continue it because it is new things. All the not only the millet diet, but only the thing is that any other new food is introducing is also we have to watch and introduce to the child. That is very important. Not only the millets, anything. Suppose we are making the porridge and we are giving that. Vegetable soup we are giving. Is there the vegetable which is allergic to that? We have to understand, we have to make them and then we'll continue the food. That is my recommendation and my suggestion.
So, thank you everyone, esteemed panel members. With this formally close this session. Can we sir? Okay sir, this one.
60 seconds. That is a very, very enriching panel. Big round of applause for all three of you. I think what Dr. Malati Shamla was saying, see, if you, because you are most of the nutritionists, some children, when they become adults, they love sweets. And you would have heard, I have 32 sweet teeth. Some people love sweets. They binge on sweets. Rasgulla, rasmalai, this, that, you give them any number of sweets, they eat it. But there are some adults who don't like sweets. They eat only mixture and this hots. They don't eat. Why? Anyone? Give them this soup, that soup, this mash, that mash, all vegetables. Or else you will have children who will not eat kakarkai, who will not eat doskai, who will only eat potato, suppose they love only potato. So you will have challenges. So that's why it's very, very important to make them taste very early in their childhood what they have to eat, what is good. That is called hardwiring. And never give sugar before 2 years. Sugar is most addictive, more addictive than cigarette and alcohol. It is more dangerous than that. So before 2 years, no sugar in milk or in paisam or in any sweet, no sugars. Even if you go to a shop, you can eat sweet, but the child must not eat the sweet. You can drink Coca-Cola, whatever happens to your tummy, it's up to you. It's already poison, you drink poison, it's alright, but not to the child. So don't get the child before 2 years, no sugars at all. And it is addictive. So all this is very, very important, is what I think the summary of what Dr. Malati wanted to say. So thank you, a big round of applause for Supriya and Anand also. Over to you.
Yeah, thank you, sir. May I request Dr. Shrikant on the dais to felicitate.
When the child is saying that I am thirsty, no mother is or no the father is, they are not going to give the coconut water or a glass of water. They straight away go to the Tetra Pak, which is available easily. So they are making that spoiling the health. That is, first of all, the education is needed for the parents, not to the child. See, if they know the children how to do that, then only the child, the infant, all this nutrition and everything that goes in one. That is the meaning of this. I think that is the main goal of this nutrition chapter. First of all, lead the education to the parents. Thank you. Thank you for giving this good opportunity by Santosh sir and Kasina sir especially. And he has given me this thing. Sir, thank you.